And these are typically the types of things that we're looking at. What sort of assistive technologies might they need? Do they have mobility limitations? Do they need help with things like grab bars in the bathroom, accessibility items in the home, either stairs in the house,
what
that makes
activities
parts
in
of
the
the
other?
home inaccessible,
What is it?
things like that. Finances. Can a person pay their bills? Are bills starting to be left unpaid? Is there general confusion?
I'll
Should
just
there
sit here and
even
listen to
be
this. Right now,
a fear
we're
of
okay,
exploitation?
but you never can
A
tell
neighbor
what I
who's
might.
pretending to be kind
There'll
who may be
there'll be a Sussex.
nickeling and diming a person who may be experiencing confusion, who really is starting to lose track of what they're doing. Medications. Is a person able to independently take their medications if a caregiver comes and maybe sets them up for them in the day of the week, time of day boxes? Or do they physically need someone to come over and say, here are your pills, take them? Are they able to go to the grocery store? Are they starting to have problems with just unpacking the groceries, getting items into their home? Just the physical act of getting through the grocery store. I know some people I talk to who, if those automated carts aren't there, they can't do their shopping. Transportation. Is it starting to be unsafe for that person to drive? Are they having cognitive issues, vision issues, spatial issues?
Remember how to get home.
Right, confusion. So what other options are there for transportation? There are programs in the community for somebody who's in the city limits called BT Access, but can the person travel independently, or do they need to have somebody go with them, accompany them to make sure that they don't get lost, to make sure that they make it when they need to go, to make sure they understand what's happening at the appointment? And then home maintenance. You've been in your home for 50 years. Things start to break down little by little. Just taking care of yard work, making sure walkways are shoveled. I mean, these can be very basic things that are critical to a person's safety in their home that can start to become unmanageable.
I know this is not for my husband because
Yes.
he's out of home, but it is for me because right now I'm in the home and
Yes.
I won't be changing until
Mhm.
for a while.
Yeah.
But I do maintaining, like I like yard work,
Mm-hmm.
but I look at the evergreens and the flowers and things, and I know I can call on people, but other people are very busy. I've even said, could I hire you to do this? Well, then they have their jobs and they'll get to me. But so is there somebody through Area 10 that I could get on a list or something that could give me names of people I could depend on?
Yes. Yes, we've got programs, and that's what I'll be talking about today too. We've got, yes, and I'll talk about that more, but that's a huge issue for a lot of people. It just starts to become overwhelming and unmanageable. And like most people, you don't want to put someone else out. They're busy, everybody's busy, and you feel bad, you don't want to ask for help, but yet you need help.
Yeah, and so I have a son-in-law that comes through with things, but
Mhm.
his life is so busy and he's involved with his children. And so then I put off doing, or I just, I really overwork myself in the yard.
Right, that's how people can end up hurting themselves, trying to do something that you probably shouldn't, or
Yeah,
working
so
too hard.
I have this from my daughter
Yes.
saying, don't do this,
Please
don't do that, you can't fall, you can't.
And one thing that is a good point, people can always say no. Give someone the opportunity to say, you know what, I am too busy. You've already answered their question and say, well, they can't help, they're too busy, I don't want to bother them. You haven't even asked. It can't hurt.
And I'm not looking for someone maybe just to do it free for me. I'd be
Yes.
glad to give them, whatever they charge.
And I've talked to people saying, where are the neighborhood kids who used to be around raking leaves and mowing the lawn? Yeah, right. So that makes things a little more difficult, actually, just accessing.
And then I won't get involved, into asking this too much, making this lengthy, but, so do you have a list of roofing contractors? Like, I know you don't have some that, okay.
But there are programs that help with major home repairs if you qualify for them. There are programs that can help as far as independent private pay contractors. We have a limited knowledge of people who can help with certain things,
Yeah.
but for those types of big jobs.
But I thought maybe there were some that were listed with Area 10 that, but I have all these names I could call on, but I thought, well, instead of dealing with some of the ones that my husband dealt with, that maybe there's someone new that,
And talking to your neighbors, finding people that you can trust can be a good way to get some help. Certainly not the person coming door to door, knocking around, who may be looking for somebody they can take advantage, but finding someone that you can trust. Yeah.
Someone told me to call your insurance company and see who they had do roofing, like with storm damage and stuff, who they would recommend.
That's a
But you say
great
that's
suggestion.
well,
That's
I know there's so much out of Area 10, and so I'm thinking,
So we'll get to
maybe I
that.
haven't connected to the right,
Yeah, we'll get to that. Housework is another area that can start to become more challenging. You might be able to do some light dusting, but running that vacuum, trying to get down and scrub your tub, carrying heavy loads of laundry, can all be difficult. And if you're dealing with some cognitive changes, confusion on how the process even works, where to start, can start to become overwhelming. You don't know the process. You can't remember how the process is supposed to start.
and so all these things I enjoy doing,
Mhm.
but then I get reminded by my daughter that,
You've got people who are willing to help if you only would ask. So getting yourself practiced in the asking part, because I know we find plenty of excuses why somebody else can't help you, but you haven't given them the opportunity because maybe they are ready and waiting. Oh, I can't, they want to be here for you. So let them.
Yeah.
Give them the opportunity. Communication. Is the person able to pick up the phone and call for help if they need it? Can they answer a call coming in and distinguish whether or not this is someone they should be giving personal information to over the phone, or things like that? Somebody may have a health condition that is making their speech impaired, their ability to communicate impaired. So how does that impact things? Is it safe for them to be alone? Dressing can start to become a challenge. Again, if you're dealing with a cognitive issue, just not knowing what you're supposed to put on or how it works. But then just the act of physically, if you've got a shoulder problem, getting your arm through the sleeve, stepping your foot into something without losing your balance, getting your socks pulled up. I mean, that can start to become a big challenge. My dad has Parkinson's disease. His professional life, he wore suits and ties. He has lots of trouble buttoning shirts. He wears a lot of pullover shirts now, shoes that Velcro, things that he can do, because it's still very important for him. He can do it, so his clothing has changed as his abilities
He's getting creative.
have changed. Exactly. And for the times he does need to dress up, he's got the tools and things that help with the buttons, that help with getting your socks up. There are lots of tools that help with those types of things. Grooming, personal care, shaving, washing the hair. Again, if it's a cognitive issue, not knowing what to do. Does somebody need prompts? Okay, now pick up the soap and do this. Does somebody just need stuff laid out and they can handle it? Bathing is getting in and out of the shower physically challenging, that big step into the tub. Are there grab bars? Does somebody need a shower chair where they can sit because standing is not safe? Do they need to be just supervised? Someone to be there, so if something does happen, there's help right there. Help with getting to the bathroom. Managing incontinence. There are plenty of people who are dealing with incontinence who manage everything themselves, who are able to clean and change their clothing. Other people are not. So depending on what kind of support. Does somebody need a raised toilet seat because the seat in their home is too low and they can't get down and get up without some support? And that goes along with transferring. Can somebody get out of bed? Can somebody get up out of a chair? Can somebody get up off the toilet with or without assistance? Maybe it's just some equipment that's needed in these certain areas, maybe a lift chair in the living room that helps get somebody up, grab bars and things in the bathroom, bed rails that help people pull themselves up. And then eating and meal setup. Is the person remembering to eat? Are they just forgetting? Are they just not feeling much of an appetite? You know, cooking for one person, they're just not getting the nutrition, just getting things that are easy. And that can obviously take a toll when you're not getting a well-balanced diet, when you're eating intermittently. If you've got conditions like diabetes or high blood pressure that can be aggravated, that makes things even worse.
Getting a drink and confusion can set in with dehydration and things just decline.
Exactly. And spiral. Absolutely. So that's just sort of a review of the ADLs. What kind of services are there? One option, if you've got the funds, is to hire the help that you need. You may hire through a company, for example. There are what are referred to as home health agencies. They're providing medical care. They've got nurses who are coming out who are, providing skilled care. There may be physical therapy, there may be occupational therapy, different services like that. There are also personal services agencies. These are non-medical. So an aide who comes and helps with bathing or personal care, who prepares a meal, who cleans the house. And these agencies are licensed through the Indiana State Department of Health, so they have to jump through the hoops that the state says they need to, including background checks and specific training. So those are an issue versus hiring an individual. Maybe there's someone you know through your church, maybe there's someone in your neighborhood, maybe a friend of a friend is recommended, but just hiring somebody. There are a lot of people who are informal caregivers. That's what they've spent their life doing, is helping people. Area 10, we have a list of private individuals who do different types of work. We list what type of work they'll do, whether or not they'll do things like overnights, whether they have limitations like lifting. And we've put them through fingerprinting background checks they've had to pass in order to be on this list. If they have any special certifications like CPR or first aid training, we include that information in the list. So the pros and cons, hiring a company, if that person, the regular caregiver is sick, unable to show up one day, often they've got a backup they can send, whereas if you're dealing with an individual, if they aren't available, there's no backup. They're not available, and that might leave you in a pinch. And looking at cost considerations, non-medical services start at usually $18 an hour through the agencies. Many may have a minimum number of hours that they'll send someone out, like a 2 or 3 hour minimum. So looking at those costs, that can add up pretty quickly. And the individuals on our list, we've got folks starting at $10 an hour up to $18. I think we've got a lady who's an LPN on the list. They have to show us their certifications and those things before we will put them on the list.
If we hire an individual,
Mhm.
do I need to send a 1099 miscellaneous to them? I pay them more than X dollars.
I'm sure there are legal things that I'm not equipped to advise you on. Chris Gall, the prosecutor's office, put together a DVD that you can find on the prosecutor's website.
It's on our website.
And it's on our website too, on how hiring a caregiver that goes through the legal options. What if the person gets injured while they're providing your care, and things like that to consider, just to make sure that legally you understand what your rights and obligations are.
How will individuals work, like by the day or by the week, or just whatever you just set up with them?
Yeah, I mean, this is your setting up a relationship with an individual or a company, and maybe you're going to be out of town, maybe it's just a time-limited thing that you need, or maybe it's an ongoing thing that you're just building into part of the care plan that gives you some respite, some time, maybe you've got some doctor's appointments, or you need to go to the grocery store, or you just need a break.
It's a bit of a dignity thing for my mother that
Yeah.
I not bathe her, and I'm okay with that.
Yeah,
So,
sure.
We've got someone coming in to help her bathe and
Mhm.
do some physical therapy. Because, again, it's just dignity for her. It's like,
Yeah.
I think she'd prefer a stranger rather than Sherry.
And I've heard other situations where I don't want a stranger seeing me, or a man who says, I don't want a lady caregiver coming. I would like them to send a male caregiver. So people have their own preferences, and you do your best to meet their needs based on your level of comfort too, depending on what the situation is. Other ways of saving money, looking at volunteer programs. Area 10 has the Caring Companions program. We do our best to match folks who are in need with companionship, a friendly visitor, just someone to come out, maybe telephoning every once in a while. Just programs that can help offer support and companionship. Nutrition programs, SNAP, which is also known as food stamps. That's a benefit that a lot of people who are living on Social Security qualify for. And it's a card, you spend it at the grocery store, they accept it at the farmer's market in Bloomington. It's worth looking into. There are local food pantries, programs that Area 10 runs, meal programs that we'll talk about later, hot meals. I mean, there are lots of resources, and all you have to do is call Area 10. They've got a comprehensive catalog of different resources in the community to meet any wide variety of needs. So if you only come away from this remembering one thing, call Area 10. Before you start spinning your wheels and pulling your hair out, trying to look things up in the phone book, worrying, wondering what to do, just call us and we can talk to you about what it is you're needing help and what we're aware of that might be able to help you. Lifeline is a federal program to help people have access to telephone service. It can be a discount on a landline phone. It can be a free cell phone with a limited number of minutes. There are income qualifications, but it's something that you apply for through the telephone company. You just call them and tell them you want to apply for Lifeline. Again, we've got more information about that at Area 10. You can call us about that. The Medicare Savings Program is a type of Medicaid that pays for the Medicare Part B premium. Most people pay $104.90. If you qualify for it, the state would pay that for you. And if you are under an even lower income limit, you qualify for a program that acts as a Medicare supplement. It pays your Medicare co-pays and deductibles, as well as that Part B. Extra Help and Fusion RX are two subsidies that help with the cost of Medicare Part D prescription drug plans that will cover the cost of the Medicare premium, and it will reduce the amount of co-pays and will keep the person out of the donut hole, if you've ever heard of the donut hole. If you haven't, you should feel it. LIHEAP is a low-income energy assistance program. There's a winter program and a summer program, but it gives a person a credit on a winter heating bill and a summer heating bill. And then housing, there are Section 8, which is a voucher that subsidizes the cost of a person's rent based on their income. Usually there are wait lists for this program, and it's announced in the paper. It's a whole thing, but they currently have closed their wait list. But senior apartments, Area 10 has senior apartments that we manage. There are other senior housing. They usually have an age limit of either 55 or 62 and older. They may have amenities like grab bars and accessibility things in the apartments. And are subsidized, are reduced rates. And some people like those options, just downsizing, finding something that's more affordable, that's easier for them to get around and maintain. But then we talk about Medicare. Medicare does not cover long-term care. So people who need home health, Medicare only pays for it temporarily. It's usually 4 to 6 weeks. It's usually after a health event of some kind, maybe a hospital stay, maybe a surgery of some kind, and it's time limited and has to be reapproved if it's going to be extended, but it does not do long term. That goes for nursing home stays as well. Medicare only pays a portion of up to 100 days in a nursing home, and then that's it. And that's only if you've had an approved hospital stay of 3 days before, you know, all the rules there. If you were just there under observation, that doesn't count. So there's also Medicare Advantage, and this is a private insurance that is your Medicare. Most people are not in Medicare Advantage plans. This was a way of trying to give people more choice. Some of these plans include some part of dental or vision and hearing aid coverage, which original Medicare does not cover. So one thing to know, this is confusing. I'm not going to go into the nitty-gritty details, but Area 10 has certified Medicare counselors, which I am one, who can help you. If you've got a notice for Medicare you don't understand, if something you thought was going to be covered wasn't, if you want to look at Medicare supplements, if you want to, during open enrollment, it's a great time to look at your Medicare prescription drug plans because they change. I help my parents every year, and more often than not, I switch them to another plan that's going to save them money. It's a free service. Open enrollment starts October 15th through December 7th. So call us and we're happy to help you. But any persistent Medicare issue, anything you don't understand, feel free to call us about those issues too. And usually if it's something pretty hairy and we can't help, we refer you to your local congressman's office because they have advocates who help constituents in their district who are having problems with federal programs like Medicare. And I'll tell you, they get some crazy things remedied pretty quickly when the congressman's office is on the phone. So we can help you, and if not, we can direct you to help. Long-term care insurance is another option that can pay for different types of care if you have purchased it. It's a separate plan. They're all different. But the purpose is to pay for this insurance before you need it, well before you may need it. And in the event that you do need long-term care, it may help with nursing home, it may help with home health, it may help with adult day services. It just depends. Each plan has a different trigger. Do you have to be in the hospital? Do you have to have had surgery? What are the triggers? But for example, I have an aunt who never married, never had children. My brother and I and my mom are her family. She long ago purchased long-term care insurance, wanting to make sure that she was covering her bases. But most people don't. But it's a good idea if you can think about it. And there is an Indiana Long-Term Care Partnership program as well. And we can help you with information about that. Veterans Affairs, there are many benefits for people who have served in our military. Of course, most veterans know if they are eligible for health care through the VA, getting their meds through the VA. My boyfriend's dad served in Vietnam. He gets his treatment and meds through the VA. If you were an active duty military person or married to a person who was active in the military during a time of war, you could have been stationed in Oklahoma during Vietnam. You do not have to be on the front lines. You just have to be in the military during that time. And you need a certain income limit. There's a program called Aid and Attendance, and it is a separate pension that pays for different types of in-home care for people who qualify. There are some people who use their pension to pay for assisted living, or just to bring other care into the home to help make their home more accessible.
I have to say the Veterans Affairs did try to help us. I mean, they were there for us. And
Yes.
of course, Mel used them. Yeah, he used them for their
But
services.
you, for something like this, you've got to apply. They're not going to come to you and say, hey, here's something you might qualify for. You've got to do the legwork. And every county has a veteran service officer. You've got that information at Area 10. We can point you to that person's office if you don't know, and they can help with this application process.
I don't know how I got all involved in it, but
Yeah.
locally, there was home health care. They provided, they
Yeah.
had all kinds of services.
Absolutely.
And they did help with some.
And as a spouse, you likely also qualify for these things. So making sure that you're getting access to the benefits. Somebody who served in the military has more than earned these benefits, and it's a shame not to access them. Especially when you're faced with how questions about how you're going to pay for certain things. Look into this. Medicaid is another health program. People often confuse Medicare, Medicaid. Medicare you get when you turn 65. Medicaid is for people who are income eligible. You can have Medicare and Medicaid both. They work together. Medicaid is the source that pays for long-term care in nursing homes. So most people who are in nursing homes for any extended period of time eventually end up on Medicaid. There are attorneys, and I think there's some legal planning that will be talked about later, but there are attorneys that help people become eligible for Medicaid through financial planning, either protecting income or assets or both. So there are ways to become eligible, even if you're not right now. Can also pay for medically necessary services in the home. Could send out home health, someone to come out and monitor the blood pressure, monitor the blood sugar, administer medications for somebody who is unable to do that, or to set them up, or to supervise the medications. But there are income and asset limits to qualify. So there is a type of service called the Medicaid waiver. This is, if you don't go to the Medicaid office and apply, this is something, these TBI waiver, traumatic brain injury, and the aged and disabled waiver are the two waivers managed by the Division of Aging. We actually have another one I didn't add to the slide that's called the Structured Family Caregiver Waiver. You have to be on Medicaid. You have to meet a certain level of need based on your activities of daily living. So you need more substantial support, like help with bathing, dressing, help with medication, help with mobility. So it's somebody who needs more support and care on a regular basis. But these programs help bring care into the home to keep people at home where, as Mary said, most people want to be. So it's about bringing what they need to them, and this is another way of paying for that. The traumatic brain injury waiver, you need to have suffered from a traumatic brain injury. The aged and disabled waiver, your medical needs need to outweigh. If a person has a developmental disability, the medical needs have to outweigh the developmental disability. There are other waivers that are specifically for people with developmental disabilities, and those are administered through, it's called BEADS, it's the Indiana Bureau of Developmental Disabilities. So any of these things, we've got information about it, Area 10, and we do screening and assessments. The Money Follows the Person grant is for people who are in a nursing home, who it's safe for them to transition home with care, who are on Medicaid. So lots of options. Well, somebody says, what if I am not on Medicaid, not interested in applying for Medicaid? What options do I have? There are these other funding streams, Choice, SSBG, Title III, that Area 10 also administers, that have different eligibility criteria. Choice, you don't need to have as much need of support with activities of daily living. Social service block grant, even less support. This, of course, is the program that has our longest wait list that we're not even adding anyone to, because this is the funding source that pays for, the person says, oh, I really need help with this housekeeping. That's what I'm really struggling with. And that's sort of the first thing that people do start to struggle with. And is the funding that sort of keeps getting cut year by year. So we are having to turn some people away because of that. Title III is a program that helps pay for things like home delivered meals. And this, you just need to be 60 or older and not driving. Or very limited driving, like somebody who maybe shouldn't be driving but is just getting to the grocery store or to the doctor. So this is the quickest and easiest thing we can get started. So thinking about things that would support you as a caregiver, having a meal, one less meal that you have to cook. We've got two different programs. One is a hot meal that's delivered usually Monday through Friday. Some areas, it depends. It could be Monday, Wednesday, Friday. But some people like the idea of having that hot meal presented to them, somebody checking in on them. It's nutritionally balanced. They don't have to think about it. We've got another group that we work with called Mom's Meals that is a national group. They do nutritionally balanced meals. They've got special diets as well, diabetic, low salt, pureed, vegan, vegetarian. So for people who may be having a need for that special diet, people who want to be able to choose from a menu, because you get to order the items that you like, and that's what gets shipped to you. So for the picky eater who wants to have the control of choosing what gets sent to them, that can be a good alternative. So there are lots of programs. Some of them do have wait lists. They all require the start with a phone assessment, where we gather information about the types of needs a person has, what their medical issues are, all things that these funding streams require. And once we determine what program you qualify for, we also have a caseworker who comes out and does a home visit to, just sort of update the information, figure out what sort of care is needed, and up with a care plan. We work with local providers. This is funding then that's used to hire someone from a local agency who comes in and does the work, who comes in and gives it back, who comes in and sets up the meds. So that is all arranged by the case manager and then paid for by these programs. So this is something you think you might be interested in, call us, because we can do that assessment over the phone and see what it looks like we can help you with. Every agency, every county, and every state is served by an area agency on aging. My parents are out, they're in Northwest Indiana, and their friends say, you're so lucky, you've got a daughter who knows all this stuff, and she helps you with everything, and your Medicare and all, and they say, there are agencies like this all over that do the same thing. It doesn't have to be someone in your family. So if you know people in other parts of the state, other parts of the country, you can call this number and get linked to the local agency on aging. Now, Area 10, we serve Monroe and Owen counties. We're the little guy on this map.
That's the Area 10.
That's it. That's where we get our name. We were not. It's not an alien conspiracy. We're not a government agency. People. This is how we got our name. Area 10. Some of the agencies on aging have changed their names. Like Area 8 goes by Socoa,
That's
Central,
easy to remember.
Central Indiana Council on Aging. There's Generations, they all, But if you know somebody who's in another area, you can call us. We've got the ability to point you to the right AAA to help you. Does anyone have any questions?
Can you tell me what area Marion County is in?
That is Socoa, Area 8.
Thank you.
Yeah.
Back to the VA,
Yes.
the aid and attendance, that would cover home health care, possible.
Yeah, it's a pension that you decide how it's spent.
Because my dad's on a disability pension.
Mm-hmm. It's just a matter of applying for it. Yeah.
And where would they get their people there?
Through the county veteran service officer. If you call Area 10, we've got the information for the Monroe and Owen County
I know
officers.
the officer.
Oh, you do?
Yeah, I'm pretty sure.
Yeah. Well, there, you've got an
Yeah.
important connection there.
But there are some, are there income limitations?
There are.
On the VA,
There are.
but it's worth exploring.
It's worth looking into, it can't hurt. And just like there are attorneys that help financially plan for Medicaid, they do the same for the aid and attendance.
So even with the home health care, there might be an income restriction on it?
Well, the home health may be part of his original health benefit as a veteran. Just a care that's ordered.
Because he's already qualified. for
Yeah,
VA
yes, for
benefits.
his health care. Yeah, absolutely. So that would just be a matter of speaking with his physician, trying to get that ordered for him.
Because he was having a few problems walking and stuff, so, and he lived alone.
Yeah.
And so we was looking into getting this alert
Yes,
button.
yes.
I called him, they said.
So, it can't hurt to ask. And, the funding streams that I went over at Area 10 will pay for a pendant as well. You can also privately pay for them. Many of them are, $25 a
I
month.
would have been, well, maybe VA might have something, and would have used it, he said he used it.
Uh-huh. Yeah. Any other questions?
You don't need to have a certain diagnosis medically to access some of these services.
Well, we do, as part of our assessment, we do go over what sort of health conditions are impairing a person's ability to manage their ADLs. So that is part of what we talk about. So is it that a person, do they have a history of heart attack and stents, and now they're having some memory problems? Do they have a history of a stroke that's left them with some long-term mobility limitations? We review what the main health conditions are that are impacting the person.
So when you call, do the phones with it? If there's a question you don't know the answer to, you can always gather that health information and all that.
Exactly.
Put it on.
Exactly, because it's not uncommon for us to be talking to caregivers, and you may not know every nitty-gritty detail that we kind of need to know. So absolutely, we'll let you know what kind of things, and it may be things that can wait until the home visit that we can gather later.
I just want to ask this generally.
Mhm.
I mean, we have a senior living in our home needing care, but we both work, and so accessing her during the day, I mean, there's some security issues, and we wouldn't necessarily know people coming in. So I don't know what kind of advice you would give. I mean, I know you said you did credentials, but then there's the house key, and how do you unlock the doors, and people coming in. But how do you manage through that?
I mean, that's definitely something, if you're hiring an individual or hiring an agency.
Or meals coming in. I mean, just as simple as meals coming in, where it's one of those awkward.
Yeah, and
Issues.
with the meal delivery, it's the same familiar face that you start to build a relationship with. I mean, people bring dog treats for pets. I mean, it's this whole thing. But if you're concerned, there are some people who won't answer the door when their caregivers aren't there because they're afraid, they don't feel comfortable. depending on what the situation is, Mary.
I can talk to you about that in particular, is that we have some places where we actually, because it just takes a while for somebody to get to the door.
She can't manage the lots.
Right, oh, okay, so she wouldn't be able to get out anyway. But sometimes we do like a cooler outside the door or something, so we can leave the meal somewhere.
Okay.
And then she has as much time as she needs to get there. So it isn't a big rush for her to get there and get to the door. So we can make that arrangement when we do the home visit.
And that can be helpful for us, even if mom doesn't eat it for lunch. When we get home, then there's a meal.
Yeah.
Right, and so you could ask for a frozen meal for that, so then you could heat it up, just once for her when she needs it. Or if you had a caregiver come in, we could have the frozen meals there and the caregiver could heat them up for her.
True.
There's lots of options like that.
I mean, in my work capacity, I work a lot with fraud in the bank.
Yep,
So I've seen some of
yes,
those.
absolutely, you have to be careful.
You do, and you do. And when you're talking about somebody who's cognitively impaired, the sweet face of somebody smiling and being sweet as pie and coming up with whatever story, I mean, we've heard those situations too, and it
Or
definitely.
she's asleep. I mean,
Yeah.
there's just realities of
Yeah.
the daytime activity or hard hearing.
Hard of hearing,
Yeah.
yep, lots
Yeah.
of reasons.
Now, there are some of the companies that do the emergency buttons, they've got all kinds of, they've got equipment that will dispense medication and will say, hey, time to take your pill. Or remote monitoring.
Red
remote
Cross, I think that's
monitoring,
it.
where
Yeah,
you
what kind of
can-
interested in that?
There's some systems out there, Sam sells them,
Mhm.
3 video cameras, a DVR recorder, and I can actually dial in on my phone and look at cameras.
Yeah.
And my fear of the days that the health care worker isn't in there, I can check it a few times a day, and if she's fallen, then I know, okay, I need to do something.
And there are some of the buttons, the emergency buttons, there are options that sense if a person has fallen.
I have seen those recently, that's a new.
So,
No.
yeah, and there are door alarms.
Is that something we would do ourselves, or is that a vendor revenues?
That could pay. I mean, that
We
could,
haven't purchased it yet, but we've sure been talking about it.
yeah.
Because the bad thing with the life alert things, like the one that we've got, if Dad would fall and become unconscious.
It doesn't, yeah. If
It
you're not
doesn't
able
know
to
which
push
button,
it.
Right,
Except
exactly.
for the new ones that are false sensitive.
Yes.
Yeah.
So it senses and it
So the one we've got.
will make that alert automatically without the person having to
How
push
it
it.
does it.
Yeah, I don't know how it works, but it's.
And when you look at, if the person is cognitively impaired, managing the button is not, depending on. Yes. Yeah.
But the bad thing is, he can't hear it. He can't hear it. Not very well. Because most of the time we don't have his hearing aids in.
So it can help to call and review things with us, because you can help, it can help to bounce ideas off, learn about other options by talking to us, things that you may not have thought about, or.
I'm thinking, my dad likes to just press buttons, he's so impulsive.
Yes.
That he
He
can
press it all the time.
Yeah.
That's pretty-
You
So-
know, so there must be something like that.
Yes. There are pads that can be by the bed that will detect if somebody's gotten out of bed. I mean, there are lots of different bells and whistles that are usually offered by a lot of these companies that do the buttons.
We've gotten better and better over recent years.
I mean, they're seeing that this is a need, it's a market need.
Technology's improved.
Exactly, and people need to be able to remotely access.
When I
And,
first started looking,
yeah,
they bombarded us. And if you call from the lifeline, they call you.
you're on their list.
That's fine.
Check out
That's
websites,
fine.
you know.
And I used to tell them I was shopping.
That's fine.
This is just in the future, it runs through my mind from time to time. I'm in the house and I'm having help from the family to take care of things. But I'm thinking, one of these days, I might sell that house and everything I see at the end right center, it seems like it would really benefit me since I'm taking care of me now. So on that senior housing over there, is there quite a wait?
There is a wait list, that's my understanding, so it's better to get your name on that
And that's what
list.
somebody that lives there now said, you know, you could fill